Hello, lovely people. Once again, we are back to continue about where we got to on the liver diseases. I'm sure you really understood it well. So please try and then just try to do some lifestyle changes in order or modification in order to help us with our daily life activities. And then if you are a student and then you are also doing your exams, you'll be able to understand certain things, what we need to do, and then what we need to also prevent. Thank you very much. Now let's go and look at the diagnosis of liver. How do we determine that there is a problem? You have to go to the hospital, and then you'll be doing a lot of diagnostic tests or laboratory tests to be able to rule out whatever the cause is. Okay, so let's take notice of that. Now we have to do a liver function test. Now we have the AST and then the ALT. Okay, this talk about the liver enzymes. Whenever they are being elevated, that should tell you that the liver is affected. So take notice of that. Okay, so under this we have a lot of them. Okay, the panels. Okay, the panel test. When we do this, we'll be able to rule out any problem that is happening within the liver. So liver function test is one of them, and then we can also do abdominal ultrasound. Abdominal ultrasound to look at the enlargement of the liver, especially whenever there's a liver problem. Enlargement is going to occur. So if it happens, so that we know that there is a problem within the liver. So we can do abdominal ultrasound. We can do a CT scan. Okay, a CT scan or computer tomography scan. Okay, and then we can also do endoscopy to rule out any problem. There can be a portal hypertension, okay, due to a liver problem. We talk more about it later on. And then liver biopsy. Here, a sample of the liver can be taken for laboratory investigation to look at the problem, okay, that is happening within the liver. Today, we are going to look at the management of a liver problem. Early recognition is very important. Now, before anything, you have to what? Go for checkup. Regular checkup is very important. So if you are going through all the signs, okay, of the acute stage of the liver problems, the tiredness or extreme tiredness, the indigestion, nausea, vomiting, and when you see all these things, please try and go for a checkup. It might be a problem with the liver. So take note. So early recognition play a major role in everything. And then we have to also maintain a healthy diet. A healthy diet. We're going to talk more about some of the diet that needs to be taken in order to reduce the effect on the liver. So maintain a healthy diet and then maintain a healthy body mass index. We spoke about obesity as one of the factors that can lead to liver problem. Obesity. So your body mass index is very important. Okay, the BMI. Okay, so meaning you have the ability to reduce your weight, especially when your body mass index is above 24.5 or 0.9. That should tell you that you are obese. Okay, or you are about to become obese. So take notice of that. So the normal BMI is for adult is 18.5 to 24.5. So take notice of that. Okay, and then we have to also avoid alcohol intake. As we said in the courses, too much alcohol intake poses pressure. Okay, put pressure on the liver. So when you reduce your alcohol intake or when you stop taking alcohol, it will help your liver to regenerate again, to be stronger, especially when it has not moved into the chronic stage. So take notice of that. And then tobacco intake. Please try and reduce your tobacco. And also avoid over-the-counter drugs, over-the-counter medication. Now, you know that this is very important. Over-the-counter medications, you don't know, somebody had just directed you to go and buy medication. So you just went and bought it without knowing, okay, the consequences of that medication. Please, any medication that you need, okay, to take into your system is supposed to be prescribed. Remember, paracetamol or acetaminophen causes liver problem. So let's take important notice to it. And then we need to prevent infection, like the hepatitis. We have a lot of vaccines in the system, okay? Hepatitis B vaccine. Go and take them, okay, in order to protect your system from getting infection. So take notice of that. And then regular checkup, as we mentioned earlier on, okay, early recognition play a major role in managing a liver problem. Okay, so now let us go and look at the diet modification. We mentioned diet modification. Okay, so we are going to talk more about it. Now we have a cruciferous vegetables. Okay, cruciferous vegetables with cauliflower. Okay, with cauliflower. Now, this is very important. Under this, we have the broccoli, we have Brussels sprouts, we also have mustard greens. Okay, mustard greens. They are all important food that help to reduce toxins from the liver, okay, or toxins from the system in order to reduce a liver problem. So take notice of that. And then we have berries, berries, berries. You know, under this we have the blueberries, we have strawberries, we have the raspberries, and then you know that this contains some antioxidants that will help us to reduce the toxins within the system to be able to what to promote a healthy liver. So take notice of that. So all the berries, the strawberry, the raspberries, the blueberries, and all those medications, all those diets, okay, food, they contain antioxidant and they help reduce toxins within the liver. So take notice of that. And then we also have grapes. Grapes also is very important, okay, in the liver problems. So take notice of that. So you can take grapes, it helps, okay, the liver. And then nuts. Nut also is very good. Beans. Beans is also good for your system. And then fatty fish. Okay, fatty fish is also very good for the liver. And then prickly pear. Prickly pear is also very important for your liver. And then we have to limit sugar intake. Limit your sugar intake, okay, if you want your liver to be strong. Limit sugar intake. And then we have to also avoid coffee. Coffee is also very important. And then tea, olive oil, and then grapefruit are all good for the liver. So take notice of this. So please, if you really enjoyed, kindly subscribe for us. Okay, that brings us to the end of the liver problem. So please, if you need anything concerned about NCLEX, try and contact us. For all your NCLEX needs, we are going to help. We have a tuition, okay, we can take you through all the process. We can teach you from the beginning to the end. Okay, we have a massive passing rate due to the content that we give to. Okay, simple, we break the content down, okay, for your understanding. So thank you very much once again. Kindly subscribe for the next videos. Have a nice day. Bye bye.